Hello, my name is Dr. James Faulkner. I am a reader in exercise physiology at the University of Winchester, and I'm also Programme Director of the HELP Hampshire Stroke Clinic, with HELP referring to a health enhancing lifestyle programme. It is a collaborative project between myself and colleagues at the university, with Hampshire Hospital's NHS Foundation Trust, in particular the stroke team on Twyford Ward, and also Hobbs Rehabilitation, a specialist neurological service that provides physiotherapy to patients. Now, our programme commenced a couple of years ago in March 2019, and to date we've worked with approximately 120 patients who have been discharged from the hospital, from the Royal Hampshire County Hospital, and they've basically entered our community-based exercise and education programme, our HELP Hampshire Stroke Clinic. Our primary purpose of our programme is for patient benefit, is providing opportunities for stroke survivors to engage in exercise and physical activity in the community with other individuals who have gone through a similar event. We're also interested in exploring research opportunities so we can try and further our knowledge and understanding around the value and benefit of exercise and physical activity in improving physiological, functional and psychosocial outcomes in this population group. And we also use it as an opportunity to engage our students, both at undergraduate and postgraduate levels, to have opportunities and experiences of working with clinical populations. I guess our blue skies approach going forward is to look at the socioeconomic benefit of this particular service and improving health outcomes for stroke patients in the local area. Now, the way the programme generally works is that we receive referrals from the stroke team, whether this is through the early supportive discharge, which is primarily led by Louise Dara, whether it's through stroke consultants such as Nigel Smith, or through the physio team at the hospital. Once they come to us, we then screen individuals. Previously, pre-COVID, we did this in our laboratory. And then once they've gone through their screening assessment, we engage them in our exercise programme. We deliver exercise classes initially for 12 weeks before we do a reassessment. We have different exercise classes that we deliver, delivered by specialist practitioners, so neurophysiotherapists, in a group-focused community setting. On completion of the 12 weeks, individuals can then continue with our programme if they want, or we can sort of identify new opportunities for them in their own local communities if they live a little bit further away from the Winchester or Basingstoke area. Obviously, since COVID, we've had to change the delivery of our programme. We've basically moved online in October, November 2020. So now we screen patients online, and we're delivering 2 exercise classes online each week, with the anticipation that hopefully later this year we'll actually be delivering a hybrid version of our clinic, whereby there will be both online and face-to-face exercise classes. Our exercise classes that we were delivering pre-COVID was basically an aerobic session called Moving On Up, a Pilates session, and a slightly higher exercise session called Get Active. Over the course of COVID, our online sessions have very much been really focusing around Moving On Up, which has been, I guess, a bit more of an aerobic or resistance band type exercise class that we've been delivering twice a week through our online system. We are currently in discussions with the Trust about developing an educational manual or tool that our patients and their carers may be able to access to get various informative content around medication adherence, or the importance of medication adherence, exercise, nutrition, sleep, risk factors, and so on. So that's something that will in time complement the exercise classes that we are delivering. Just to show you a little bit of data, so this is from over 110 of our stroke and TIA patients that have been referred to our programme. We've seen really nice favourable changes in blood pressure, systolic, diastolic, and also mean arterial pressure. We've seen favourable changes in functional outcomes in terms of reductions in timed up and go tests, and nice improvements as well in our 6-minute walk test. So we're showing some really important benefits in terms of physiological, functional, and some quality of life outcomes that we're also capturing through some questionnaires. So that's the programme that we've been running for the last couple of years, and we envisage to continue to develop this programme with the Trust going forward. If you have any questions, or you'd like to get in touch in the future, please don't hesitate to contact me through my email or through Twitter.